Stop eating turmeric now if you have these health issues. Turmeric might be the golden spice of health, but here's the thing. It's not safe for everyone. And today, I'm breaking down exactly who should avoid it, why it can cause problems, and the 5 conditions where turmeric or curcumin supplements can do more harm than good. Stick around because by the end, you'll know if you're in the clear or if it's time to rethink that daily turmeric capsule. This isn't medical advice. I'm here to share research and information so you can have a better conversation with your doctor. If you're on medications or have chronic conditions, check with your healthcare provider before making changes. Okay, let's start by clearing up a common confusion. Turmeric is that bright yellow spice used in curry and golden milk. Its star compound is curcumin. That's where most of the health benefits and risks come from. Here's the catch. The turmeric you sprinkle on your food, that's usually fine for most people, but turmeric supplements, the capsules, extracts, or those super absorbable formulas deliver way more curcumin than you'd ever get from cooking. And that's when it can start to mess with your blood, your bile, and even your kidneys. So when we talk about avoiding turmeric today, we're mostly talking about high-dose supplements, not the pinch you toss into a stir fry. Here's how we're going to break it down. I'll walk you through gallbladder disease and bile duct problems, kidney stones, especially the calcium oxalate kind, bleeding disorders, blood thinners or upcoming surgery, diabetes on medication, and last but not least, iron deficiency or low ferritin. Then we'll cover some bonus cautions like pregnancy, liver issues, and drug interactions, and finish with a quick safety checklist you can screenshot. Let's start with the gallbladder, a little organ that can cause big trouble. If you've got gallstones, inflammation, or a blocked bile duct, turmeric supplements can actually make things worse. Why? Turmeric naturally stimulates bile production. Normally, that's a good thing. But if your bile ducts are blocked or inflamed, forcing more bile through can increase pain, trigger an attack, or even land you in the ER. Think of it like trying to push more water through a clogged pipe. Not a great idea. And yes, this risk is much lower if you're just using a little in food, but those high-potency capsules, totally different ballgame. If you've been told you have gallbladder disease or bile duct issues, skip the turmeric supplements unless your doctor specifically clears you. Gallbladder problems aren't the only digestive-related condition you need to think about. The next one is also tied to your stomach, but in a completely different way. Here's something most people never hear about turmeric. It's naturally high in oxalates. And if you've ever had a calcium oxalate kidney stone, you know how brutal that can be. Human studies show that turmeric supplements can increase the amount of oxalate in your urine, which raises your risk of forming stones again. And we're not talking about small changes. This effect was clear enough that researchers warned stone formers to avoid high-dose turmeric. Now, some people think, well, I'll just drink more water. And yes, hydration helps. But if your body already tends to make stones, adding extra oxalates from a supplement is like giving your stone-making factory more raw material. If you've had stones before, especially calcium oxalate ones, the safest move is to avoid turmeric capsules. Cooking with it in small amounts is usually fine, but still worth mentioning to your doctor. Now, let's step away from the stomach and talk about something far more serious, your blood, because turmeric can actually thin it. Here's where turmeric's healthy benefits can backfire in a big way. Curcumin, the active compound in turmeric, can make your platelets, the tiny cells that help your blood clot, less sticky. That means it acts like a natural blood thinner. For most healthy people, that's no big deal. But if you're on prescription blood thinners like warfarin, apixaban, or clopidogrel, or you've got a bleeding disorder, or you're scheduled for surgery, that extra thinning can increase your bleeding risk. Doctors often tell patients to stop turmeric supplements before surgery for exactly this reason. And if you're on meds that already thin your blood, combining them with high-dose curcumin can tip the balance too far. Bottom line, if you're on any kind of blood-thinning medication or you've got a procedure coming up, put turmeric supplements on pause and let your medical team know. The next condition is where turmeric's blood sugar lowering effects can go from helpful to dangerous. Turmeric can help lower blood sugar. Sounds great, right? Well, not if you're already taking medication that does the same thing. If you're on insulin or oral diabetes meds, adding a turmeric supplement can push your blood sugar too low, what doctors call hypoglycemia. That's when you might feel shaky, sweaty, dizzy, or even confused. Now, if your doctor is monitoring you closely, there are cases where turmeric might be used alongside medication. But doing this on your own, not a good plan. If you've got diabetes and you're already on treatment, talk to your provider before adding turmeric supplements. Food level turmeric is usually fine, but the capsules can be potent enough to cause problems. And that brings us to another group of people who often think turmeric will help them, but it can actually backfire. Before we dive in, if you want to check out the science behind what I'm sharing today, I've dropped all the article links below in the description so you can read them anytime. Okay, now if you've been struggling with iron deficiency, turmeric might be working against you without you even realizing it. Research shows curcumin can bind to iron and make it harder for your body to absorb. In fact, studies have found that turmeric can reduce iron absorption by anywhere from 20% to 90%, depending on the dose. So if you're trying to rebuild your iron stores, a daily turmeric capsule could be slowing down your progress, especially if you're taking it with meals or your iron supplement. If your ferritin is low, skip the turmeric supplements until you've corrected the deficiency and your doctor says it's okay to restart. Now that we've gone through the 5 main conditions, let's talk about a few other situations where turmeric isn't the best choice. Pregnancy and breastfeeding. Food amounts are usually fine, but high-dose supplements haven't been well studied, so most experts recommend avoiding them. Sensitive stomach. If you have acid reflux, ulcers, or gastritis, large doses can trigger heartburn or stomach upset. Liver concerns. Rare cases of liver injury have been linked to turmeric supplements, often in high-potency forms. Drug interactions. Turmeric can affect how your liver processes certain medications, meaning it can change their levels in your blood. Let's quickly go over the 5 main conditions again. Gallbladder disease or bile duct problems, history of kidney stones, bleeding disorders, blood thinners or surgery, diabetes on medication, and iron deficiency or low ferritin. And remember, we're talking about supplement-level turmeric, not the occasional pinch in your cooking. Before you take turmeric or curcumin supplements, ask yourself, am I on blood thinners or diabetes meds? Do I have gallstones, kidney stones, or low iron? Is surgery coming up soon? Do I have liver issues or sensitive digestion? If you said yes to any of those, check with your doctor before you take another capsule. So what should you do if you're in one of these groups but still want the benefits of turmeric? Stick to food amounts. Use turmeric as a spice in cooking rather than taking high-dose supplements. Consult your doctor before starting turmeric if you have any of the conditions mentioned. Pair turmeric with black pepper for better absorption, but again, in moderation. Turmeric can be an incredible addition to a healthy diet, but only if it works with your body, not against it. If you have any of these 5 conditions, it's worth talking to your healthcare provider before making turmeric a daily habit. The key is knowing your own health situation and making informed choices.